Ben Addley. I am the Chief of Oxford County Paramedic Services. So I'm responsible for overseeing our ambulance and paramedic service delivery for the County of Oxford.
And Ben, just talk a little bit about how this pandemic has been affecting the ability of your crew to do their jobs.
It's as far as actually doing their jobs, our paramedics are still out there. Our staffing levels are very good at this point. And so we still have the ability to respond to our calls, our emergency responses, even in spite of the pandemic itself. However, it does obviously impact how we go about doing those responses more than anything at this point. The protection of our paramedics, as well as the patients that we are responding to, is the utmost importance to make sure that we don't have additional spread of the disease in the community, but as well to our paramedic staff themselves, to keep them healthy and working.
And what kind of protocols are in place now when somebody makes a call for your service? Would they be asked a series of questions regarding the call, or how does that play out?
Actually, that's a great question. Right off the start, when somebody places a 911 call for paramedics, right at the screening, the dispatcher is going to ask questions with regards to their potential to be COVID infected. So similar to the questions that you've seen in the screening tools, such as the travel history, whether an individual has a new onset of a fever, a cough, kind of the flu, cold-like symptoms that indicate there's a potential for the COVID infection. So utmost importance to make sure when that screening has happened, people are honest and forthcoming with those answers, because it's part of the screening that we need to make sure that our paramedics, when responding, wear the appropriate PPE. It's not going to impact the fact that we're coming to help, just how we're prepared and what protective equipment that the staff are wearing when they're showing up. On arrival, the paramedics will kind of repeat that screening in-house to make sure their safety before kind of furthering on their care.
And are you able to talk about the numbers of calls? Have the calls increased for your service, or have they just stayed the same? I'm curious, because people sometimes, when they're feeling anxious, they might be a little bit more prone to call 911.
Yeah, that certainly can be understandable in some circumstances. As far as the COVID cases themselves, the best spot to get the information on that is through the Southwestern Public Health is posting how many COVID patients and confirmed, as well as number being tested in the communities, both Oxford and the Elgin St. Thomas area. We often see that in situations like this, when there's a pandemic, yes, people are a little more alert about that specific illness itself, but they tend to also revert to only calling when items of the utmost urgence and emergencies, and tend to stay away from the hospitals for other maybe less acute situations that happen that normally they may go to the hospital on. So luckily at this point, those two have balanced each other out. Our call volume hasn't significantly increased, even though the calls for kind of a acute, I would call them respiratory and COVID-like symptoms may have increased.
Okay. Now, speak a little bit about, you've asked the community to come up with some PPE. Just talk about, what is PPE to begin with, and what items are you looking for exactly?
So personal protective equipment, or PPE, it's the short for. Basically, that is the type of protective equipment that healthcare workers, including paramedics, wear when they are in contact with patients that may be exhibiting symptoms. So that is the surgical masks, what we call N95 respirators, which are a little more protective than even the surgical mask, the gowns, the visors that you'll see them wear, which are the standard for preventing exposure to droplet or respiratory type illnesses. As you've probably heard and the community's heard, there's a significant shortage nationally and internationally on getting those items. As this has been a international pandemic, lots of countries have, the need or the desire to get the protective equipment to protect their healthcare workers in the community. So healthcare in general is looking for how we can procure those through our normal procurement chains, through provincial measures, as well as reaching out to the community and say, hey, if you have these, whether you have them because maybe in your normal practice of a dental office and not currently using them, you may have some of these items available. Different organizations may use them for protection of their staff, or in different areas as well too. That if the community does have them, the healthcare agencies are accepting those and using them as the inventory. So it's not just us in paramedic services, the hospitals are putting out that same offer as well too. And the good thing to know is that we're coordinating that all together, and we'll be sharing it among those agencies. So even though paramedics are saying, hey, offer it up if you have it, so are the hospitals, and we'll be sharing those resources in our healthcare agencies.
Okay, so if somebody is watching this and they have some of that equipment, how do they go about getting it into the right hands?
So one of the options is contact Paramedic Services. EMS at oxfordcounty.ca is our email address that contact can be made through. And then similarly, the hospitals have advertised that they have contacts that can be made to arrange for either pickup or drop off of those items that are needed.
Is there anything else you want to say to the public?
I think, again, just like all the healthcare out there, certainly encouraging people to stay at home, listen to the recommendations that are being made by our government health agencies, our local public health and provincial public health. Take it very seriously that, to help prevent the spread of this, listen to the social distancing, stay home if you're sick, self-isolation as required for the 14 days to make sure we're reducing the spread in the community.
All right, thanks a lot, Ben. I'm John Payne for Rogers TV.
Thank you, John.